I'm Dr. Jeevan Udupi, the Senior Lecturer, Department of Radiology, Faculty of Medicine. Today I am going to show you how to do an ultrasound on thyroid gland. Thyroid is a very important endocrine organ in our body. That ultrasound played a major role in imaging pathologies and excluding neoplastic lesion, inflammatory diseases. So we move to the study how to do the ultrasound. First, I have to set the settings in the ultrasound machine. After that, I'll start seeing the thyroid like that. You have to keep the patient's neck extended, and you have to make sure that patient is comfortable. So this is the midline structure, that is the trachea. You can see the air column within it. This is the Now, either side of the trachea, you can see the right lobe, isthmus, and left lobe of the thyroid gland. So, this is the cross-sectional or transverse section of the thyroid gland. So, now I am moving to the right lobe of the thyroid gland. This is the transverse image, and this is the longitudinal image of the right lobe of the thyroid gland. So, lateral to the thyroid gland, you can see the carotid artery and internal jugular vein. If I put the color Doppler or the color flow, you can see the color flow within the vessels. So, if I put the Doppler study, so we assess the echogenicity of the thyroid gland, echo texture of the thyroid gland, size of the thyroid gland, and see whether there are any abnormal lesions. So this is the right lobe. I am starting transversely from the inferior pole and moving towards the upper pole. I see the normal homogeneous echogenicity, echo texture of the thyroid gland, and there aren't any focal lesions. So longitudinally also I am assessing. I am starting more laterally and moving towards the midline. And now I am assessing the isthmus again. This is the isthmus. Okay. Isthmus again. That is the isthmus, and I am moving to the left lobe of the thyroid gland. Again transverse section from lower pole, and I am moving towards the upper pole. Again, I notice normal echogenicity, normal echo texture of the thyroid gland, and no abnormal lesions. So now I am putting the color Doppler to assess the vascularity of the gland. So this is the normal vascularity of the thyroid gland. The conditions like thyroiditis, in acute thyroiditis, you see increased vascularity of the thyroid gland. That is the vascularity of the left lobe. I am putting the vascularity, checking the vascularity in the right lobe. That is the normal vascularity in the right lobe. Again, now I am checking the common carotid artery and internal jugular vein on the left side. And after that, we are checking any cervical lymph nodes. So this is transversely I am taking from inferior to the superior aspect of the neck. I am doing like that, and I don't see any abnormal lymph. This is a lymph node which is normal. You can enlarge the lymph node and see, and you can see nice oval shape of the lymph node with echogenic set. This is, and it is not enlarged, and it is preserved echogenicity, preserved activity. So this is the reactive lymph node. Again, I am seeing the left side also lymph nodes, and there are few more prominent lymph nodes. Still the preserved architecture, central echogenic hilum, and thin cortex, and the oval shape structure. So this is the cervicaleomastoid muscle. You can see from its origin to its insertion. This is the cervicaleomastoid. This These are the sides trigonostoid muscle. Again, you can see from its origin to its insertion. And that is the cross section, and this is the longitudinal section. You can see the elongated fibrillary pattern of the normal muscle. And here I am seeing the submandibular gland on the left side. You can see this echo-density, echo-texture similar to thyroid gland, but usually it is less than the thyroid gland. So again, you can see whether there are focal lesions, enlarged gland, or lymph nodes. So again, I am checking. This is the right lobe of the right submandibular gland. So now I am seeing the parotid gland, which is in the preauricular region. This is the normal appearance of the parotid gland. This is the upper pole, and this is the inferior pole. Usually we can see the superficial lobe of the parotid gland. Deep lobe we can't see clearly in the ultrasound. I am checking the left parotid gland. Again, this is the upper pole, and this is the lower pole, and this is the longitudinal section. That is the normal echo-density. We can see any focal lesions, duct dilatation, or calcification in the thyroid gland. So today I have shown you how to do a thyroid gland and what are the structures we can identify in the neck ultrasound. And as this is a normal scan, I could not demonstrate any pathologies. Thank you.